Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com. And today we're going to talk a little bit more about Cants and asymmetries and how this affects your orthodontic treatment. This is going to be talked about from a doctor's perspective, but if you're a consumer, you're welcome to listen. It might be a little bit high level for you. But in any case, a lot of people are not symmetrical to get started. So not a big deal, you know. If it's something that really bothers you, often it can be fixed with surgery. If a child is still growing before they've reached peak puberty, it's possible if there's an asymmetry that it could be something that is corrected, especially if it's an asymmetry in the lower half of the face. It could be something that is corrected by orthodontics or growth modification. If you're done growing, most likely the asymmetry would have to either be camouflaged by some type of fillers or something like that at the plastic surgeon's office, or you can have a jaw surgery to go ahead and correct it. If the asymmetry is something very serious where you're having issues with function, with chewing, with eating, things like that, with airway, it might be fully covered by your insurance, so never rule it out. So for example, the way I like to kind of look at it is I really like to take, this is why you have to take your photos for your patients with their hair out of their face, tucked behind their ears, can't have their face mask on, can't have hats on, headphones on, anything like that. I see a lot of patient photos that doctors submit to me and I'm like, okay, you know, if you have all this stuff on their face and neck and head, we can't really look for asymmetry. So all the hair needs to be out of the face. Hair needs to be tucked behind the ears. Earrings, jewelry needs to be off so we can really take a good look at the patient. Head should be vertical, not tipped, not tilted. And we really want to visually, and I'm not saying I do this on all patients, I don't draw these lines, you know, but I visually look at it. I look at the patient in the office, I look at the photos, and if I see an asymmetry, I might double check, you know, just to make sure. In that case, you can have an asymmetry and still have a good bite, but your bite might be canted like this. So this is, I see the word cant being thrown around a lot. So you can have a skeletal cant, which is like this. I mean, clearly you can see in the skeleton that it's canted, right? If we drew a line against, you know, that was parallel to the occlusal plane like this and a perpendicular one, you know, you'd see that it's canted. Theoretically, if you draw this line down and draw this line like this, it should look like this, not like this, right? Well, this is a flip-flop version, but you get the idea. So just things, you know, I think a lot of doctors are hesitating to bring up this topic with their patients when they see a cant because it might be very subtle and maybe you as a doctor have better eyes than the patient and they maybe have never noticed it. Even I have an asymmetry in my face, definitely. My nose is a little asymmetric, my occlusal plane's a little asymmetric, my face is a little asymmetric. Hey, we all want to be symmetrical, but we aren't all. So it is what it is, but it's very subtle, you know, and it's not something that I'm looking to get fixed. So, but I just want to make sure before you jump in doing orthodontic treatment with the patient that you do identify those asymmetries or cants and see if it's something that the patient wants to get fixed. You never want to assume or make assumptions that the patient doesn't want to get it fixed because the patient might be assuming you are going to fix this and that this orthodontic treatment will fix it. And very likely, if the patient is done growing and it's a skeletal asymmetry, it will not fix. So I have personally gotten myself in trouble before. It's one of those rookie mistakes that you make, you know, newbie mistakes, where you're like, oh, I don't want to cause trouble. I do remember being a patient in the orthodontic chair, and my orthodontist was, he was the head of the AAO, so he's a very, very, very well-known orthodontist in the 80s, you know, very educated. And of course, you know, he taught ortho at an orthodontic residency. He was very thorough, right? And I remember him going over the asymmetry with my parents and mentioning it. And at that time I was done growing, I was 17. And I remember, oh man, he didn't do it right. Because I remember having a huge complex of it from there on out. From there on out, you know, about my profile, about my asymmetry. I remember never feeling quite right about myself and the way I looked for a long time after that. Because I was like, oh man, I'm asymmetric, I'm abnormal. You know, so you have to be really careful in how you present it and how you talk about it and make sure, especially if it's a child, I just want to put that out to you, be really careful. I'm not saying don't have them in the room, but there's a way to say it and there's a way not to say it. So I'm going to give you some scripting right now that I would use to say it. So Goodness, I mean, you can use the same scripting, for a child that maybe has a slightly larger chin or a slightly larger jaw, and you just have to be really, really, really gentle with your explanation and not say it's wrong. Just say, sometimes I'll look at something like my fingers or my toes, and I'll start with something really easy like that, and I'll say, there's all different types of faces, right? Or I'd say there's all different types of toes, So sometimes some of us have this toe longer than another. Some of us have this toe longer than another. Same thing with fingers. We're all a little bit different, right? Same thing with faces. Some of us have bigger jaws, bigger chins, smaller chins. It's not wrong or right. It just is, And I just want to point out to you that we're not all quite symmetrical, And you can even say one hand is often a little smaller or a little bigger than another. I know, for example, ring fingers is an easy one to discuss. I've used that. I'll say my ring fits on the left finger, but it doesn't fit on the same finger on the right. Just a little asymmetrical. That's okay. Same thing with faces. Sometimes, we will have one side of our face a little more down than the other side of our face. Who knows why, If you know they're a religious person and you feel comfortable talking like that, you can bring that in. That can be very comforting in certain parts of the country. If not, I wouldn't go that direction. But you say we're all made different ways, and that's what makes us unique, just like fingerprints, So I just wanted to point out that there's a little asymmetry, on your face. That's okay. Because so-and-so is growing, isn't growing, there might be an opportunity to improve it, or there might not. I just wanted to point it out because it's part of my diagnostics to make sure that you knew about this, and I just wanted to address it to see if that was something that you guys were thinking about fixing, or if it was something that was even a concern. And just bring it up, and then if they're like, oh no, it doesn't matter, okay, great. You brought it up, documented that you had that discussion, boom, done. Because I've had it happen where I didn't bring it up, I think I mentioned that, and then later at the end they're like, well, what about this? And I said, oh, we can't fix that with braces. And they're like, what? That was the whole reason I had braces. And I know you all are thinking, well, why didn't they mention that in the chief complaint? Well, people don't always mention that in the chief complaint. They'll just say straight teeth, but they're thinking that jaw correction is part of straight teeth. In that case, honestly, if that happened, you might be giving a full refund. There's definitely grounds for it, and there's definitely grounds for complaint. And I'm not saying most patients would take it to that level, but there are patients that will escalate it to insurance, to a dental board, and be like, dude, this person ripped me off. I went to get this fixed. And if it's something pretty obvious, they're going to say, well, did you document it? Did you notice it? And if it was something, as severe as this, for example, I know you're seeing the skull, they're going to say, how come you didn't take a PA X-ray? How come you didn't offer the patient the option of jaw surgery to refer them out? And this just literally goes into the whole conversation about compromised treatment. Be really, really careful with your compromised treatment unless you're giving the patient perfect, which in a lot of cases might include jaw surgery, and 99% of the patients probably won't do it. They'll probably say, braces is fine, straight teeth is fine. Okay, that's totally fine. I just wanted to make sure you knew about it. You knew that was an option. It's not something that I do, but I can refer you to a doctor who does do it. I know you might think it's expensive, but it's not always expensive. And sometimes it's fully covered by insurance. It's not something that I know that much about, but I can send you to people who can. I just want to make sure you have all your options. Again, I can't, for those of you who work with me in my consultancy practice, you've probably had a few lectures from me because it's really something I feel very strongly about, because I've seen people get in trouble. And I'm not saying I've gotten in trouble before, but there's plenty of times when I work for other orthodontists or work for other corporations where they'd be like, don't even mention it. Well, no, I can't do that because that's below standard of care. I have to mention it. And you know what? If the patient wants to get that jaw surgery or wants to get that referral to learn more about it, I'm all for it, even if it's not something I'm doing, because that's part of them getting educated and making an informed decision. 99 times out of 100, they still come back to you for the treatment. Maybe occasionally they don't and they stay with the other doctor. That's all right, because you know what? This patient was educated and got to make an informed decision, and that keeps you out of hot water with your cases. All right, anyway, so that's my little diatribe today. Hopefully you learned something about canting, and you know what? It's okay to be a little bit canted, and again, even if it's something not that serious, a lot of patients will point out later, hey, you caused this. Well, unless you pointed it out at the beginning, well, you might be given a refund. So, all right, thanks so much.